On that note, good time to remind you that Medicare annual enrollment is here, and if you have no idea what that means or if it even applies to you, well, TVL here to help you out. And joining us today is Tiffany Neighbors with Viva Health to help us make sense of it all. Tiffany, this is a big topic, and I think it's one of those conversations that people are they're a little embarrassed to say we don't know anything about it, right? So kind of, if you can, with the basics, Medicare, what is it? How does it? I mean, nothing's free, right? We got to put money into it in kind of a big pot so that it kind of can be shared with the community. How exactly does this work? Because there are so many different types too, A, B, C, and D.
Well, you're right. It can be very, very confusing and overwhelming to a lot of people. So I'm hopefully going to be able to help you with that today.
Yeah.
This is our annual enrollment period for Medicare. That's a lot of people call it AEP for short. And for Medicare eligible individuals, this is the time of year where they need to review their coverage to make sure that they're in a good place for the next year. Annual enrollment begins on October the 15th and it ends on December the 7th. And this is a great opportunity for you to understand a little bit more about original Medicare versus Medicare Advantage plans.
Yes,
so,
you mentioned those two different terms. Kind of, again, they're just terms to us at this point. So break down the difference between those two. Again, original Medicare and Medicare Advantage.
Okay, so original Medicare is going to be basically your Medicare Parts A and B. That's your hospital and your doctor's coverage. When you have a Medicare Advantage plan, on the other hand, that's also going to cover everything that original covers. Plus, it's going to have drug coverage, which is better known as Part D. In addition to that, Medicare Advantage plans are going to have many, many extra benefits, and those can range depending on what the plan is. It can be anything from dental and vision coverage, access to gyms, and over-the-counter allowances, and so much more.
Yeah, certainly so. So again, different types of plans depending on what you want, included. Again, the doctor's visits, and even as far as to even just gym coverage, prescription coverage, what have you. And so with that, let's kind of maybe chat again. A lot of people, it's online typically with your company. What are things that we should kind of look for? Again, I think some people just kind of fly through it and click it, but any kind of certain things we should flag and take note of?
Yes, absolutely. So first and foremost, know that benefits will change every year. And so it's important that even if you're already on a plan, you take time to review the changes for the upcoming year, because you want to make sure that you're covered in a good place. If you're new to this, some of the questions that you might want to ask are my medications covered? Are my preferred doctors covered? What are my out-of-pocket costs going to be? Would I be covered in the case of an emergency? Things of that nature are questions that you're going to want to ask. And luckily, we here at Viva Medicare are happy to answer those questions. You can give us a call, no pressure, no commitment, and we're happy to guide you through the process.
Certainly so. And with that, we're going to flash up the information. Again, this is Viva Health, and we're so grateful too because, again, you guys are local, right? You have a local approach to forcing this, again, within our community, and we're so grateful for it. Again, on standby to help you because it can be a big process. So with that, my friend, thank you for coming on for what you
Absolutely.
do. I don't know how you do this line of work because somebody called and asked me for help. I'd be like, I don't know, click yes and just scroll and click submit. But thank you again for who you are and what you do, and take care. I know these next few weeks and months are going to be busy, so we still appreciate it. Thanks.